BI India Diabetes BU is no stranger to the limelight. With 3 successful brands in the portfolio, our motto was always Dare to Dream. Our vision and objectives were aligned to make the dream a reality. Achieve number 1 rank among MNCs in the patented diabetes market. We had our own set of challenges in India. Grow the existing portfolio. Jardiance was ranked number 4 in the mono OAD market in December 2017. Only 18% HCPs believed in cardio protection in December 2017. Challenge 2. Optimize SOV for portfolio versus competition to win in the market. For Glixambi, we had our fair share of challenges too. Delayed launch of Glixambi along with Jardiance Met launch. Portfolio balance with 5 brands till October. Establishing the patient profile. Price remained the number 1 barrier. We overcame the challenges by focusing on what had to be done in the best manner through every action that we undertook. For Jardiance, we adopted a practical approach by conceptualizing the Indian clinical management of T2DM with ASCVD algorithm. We rolled out the steering committee in January and published it in May after just 5 months flat. We used the ADA guidelines Level A recommendations smartly and cascaded it across in-clinic, digital and ex-clinic channels. For Glixambi, our pre-launch and post-launch in-clinic and out-clinic initiatives ensured customer interest and generated sustained visibility (SLS). We came up with a 1 pill, 10 benefits communication to create a unique and superior value proposition for Glixambi. Efficacy was kept at the heart of Glixambi's value proposition, as this is the topmost driver for HCPs to prescribe any OAD. And the results speak for themselves. IMS trends demonstrate an impressive uptake. BI India retains its legacy of leading the shaping of the country's SGLT2I and combinations market. Both Glixambi and Jardiance Met have exceeded their 2018 outlook numbers. With Jardiance, 56% HCPs believed in cardio protection in T2DM patients with CVD, a whopping 3-fold increase across specialities. And the icing on the cake, we accelerated from our number 4 position in December 2017 and moved to the number 1 spot. Our performance across the portfolio has reinforced BI India as the natural choice for future leadership in the Indian patented OAD market.
So, what we need to highlight is that it is not only treating the glycemic parameters and not only the weight loss or slight reduction in blood pressure, but you are offering cardiovascular death, magically all-cause mortality. Magically, patients don't die if you have heart disease and diabetes. 38% will not die somehow. And also the benefits in heart failure. So once that part is taken care of, highlight the 45% meta-analysis now showing that 45% preservation and benefit in renal deaths and renal composites. So now it is no longer about presence of established cardiovascular disease and the cardiovascular and renal benefits thereafter, but you are also talking about absence of cardiovascular disease, and yet the benefits go across the board. So any diabetic, the moment you have used up metformin, I guess it's a great choice to employ Jardiance to offer benefits not now, but even for the future.
You have 2 drugs with you, Jardiance and Jardiance Met. I would say that given all the benefits that Jardiance has, number 1, a very powerful glucose reducing agent, number 2, reduction in blood pressure, and number 3, a very significant reduction in the body weight of all patients, it comes out as a clear winner. No other study on oral anti-diabetic drugs has had this tremendous beneficial effect in preventing heart attacks and cardiovascular disease as Jardiance has. And therefore, it has now been picked up by cardiologists who are beginning to use Jardiance just like a statin or an aspirin for preventing heart attacks. So just imagine you have a drug which is meant for treating diabetes, but in the bargain, it also prevents heart attacks. So it's actually a 2-in-1 drug. I would urge you all to show these benefits to all the doctors and the medical professionals that you meet, highlighting the advantages of Jardiance. Even within the class of the SGLT2, Jardiance stands out as number 1 because the other 2 drugs, one of them has side effects like fractures and so on, and the other one also at best has just been neutral with respect to cardiovascular safety. Here is a drug which is actually beneficial, which has a superiority benefit which no other drug has got.
It's time now to step on the pedal in 2019. It's time now to dream big and become the #1 mono OAD across all specialties such as endocrinologists, diabetologists, cardiologists and consulting physicians. We are up to the challenge.